Sonja Brune.
And I work with Sonja Brune.
Or for Sonja Brune.
Well, ladies first.
Okay. Well, hello, I'm Sonja Brune. I'm an advanced practice registered nurse specializing in heart failure for more than 25 years here in San Antonio, Texas.
Wow. And I'm Landon Wellford. I'm the director of the Heart Failure Service, and I have the honor of working with Sonja. And I've been in San Antonio since, I think, 1987.
So, how long have you been in the profession total?
Well, I started cardiology training at BAMC in '87, stayed on as staff, and actually directed the transplant unit there, which was an honor and a lot of work.
So, given the fact that you have been a practicing physician for over 4 decades now,
Yes.
would you care to share with us what some of the greatest advances have been in these last 40 plus years?
Sure. So heart failure has come a long way. When we started transplant, you had transplant and immunosuppression and maybe an ACE inhibitor or two. But now we have the 4 pillars of heart failure where we don't have to go to transplant as often. We have the ACE inhibitors, the angiotensin receptor blockers, the beta blockers, which we're very familiar with, the SGLT2 inhibitors, and medicines like albactone are beautiful, and you titrate them well, I might add. Thank you for your help in advance. The pacers are better, resynchronization is better, the defibrillators are better, they're smaller. It's night and day. We've come so far. Yeah, I think we're finding out that as long as we keep the heart from getting weaker over time, it actually gets stronger. And you and I were taught that was not really possible, and now we're finding out that's probable.
That is very true. So, other than being able to work with me on a daily basis, what would you say is your favorite part of your job?
Okay, heart failure is fun, and it's also demanding at times. It's fun to find a patient who comes in, they're scared, they have this new diagnosis, they're not breathing, they don't look well, they don't feel well, and you walk them through these series of titrations. You start the medicines and you ramp them up. And over time, the breathing gets slightly better, they start to pink up a little bit, and all of a sudden they return to the land of the living. And that's kind of fun.
Mm-hmm.
That's the best part, but it's not instant gratification by any means. Now I have some questions for you.
Okay, I'm ready.
Why do you have 24 initials behind your name?
Oh, very good question. So, I became a registered nurse also in the 80s, even though I'm not nearly as old as you are. But I came to have a love for cardiology, and I realized that as a nurse, I wanted to set myself apart and show that I was really devoting more effort into doing what I love, what I have a passion for. And so that's what all those letters mean, aside from just my degree, is board certifications, and then also proud to say I'm a fellow.
I was going to ask you that. How many fellows of the Heart Failure Society are in San Antonio?
Well, at one point I only knew of 3. I haven't looked to see.
Last time I checked, there were 2 actually, but I don't know about the 3rd. So yes, you are 1/2 or 1/3 of the fellows in our esteemed city.
Yes, and I'm very honored to
That's
be
a lot
that.
of work.
It is a lot of work, but it, I feel, helps to support my dedication to caring for the patients that need me the most.
There we go. What do you like best about your job, and where do you see this evolving to?
Well, what I love the most about my job is being able to have what I consider a luxury of time with the patient, which not all providers have that, but I am able to set aside more time with each patient and start with getting a very good understanding of what the patient knows about his condition. Because sometimes when they come in to see me for heart failure and I'll ask them, well, what do you know about your heart? It's not nearly what they really need to know, because either they've not been informed or they've not been able to understand what's been told to them. So just getting that general understanding of what the patient has knowledge of, and then build upon that, give them the information they need to be able to make informed decisions regarding their care.
And I like that. And I also think part of the problem is when you tell someone they have heart failure, they hear heart failure and then they shut down.
Right.
They just don't hear anything else. And you're just like in the Charlie Brown cartoons, wah, 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 wah. And
Right.
They don't hear anything. But some of it seeps in, and then you get to reinforce. I get to reinforce back and forth.
Right,
So
exactly.
I think that's actually key. I'm amazed how sometimes we think the patient understands what's going on, and you leave the room and it's beautiful. I send them your way and they just did not retain anything, to the point where I'm like, okay, I'm just going to send them to Sonja and we'll just do it that way.
Send them to Sonja, yeah.
It's a bumper sticker I'm going to make, yeah.
Oh, I like it. I like it. But I really think that education is the key, because it empowers the patients to have more knowledge about their condition and participate as part of the team, because it is a team approach and the patient's a big part of the team, and they realize that with us. And so communication, education, and the time being able to spend with these patients, I think, is crucial to help them have their best possible life with the heart they have. I was leaving one of our clinics the other day and got in an elevator, and I had all of my stuff with me, and a lady in the elevator looked at me and said, "You must really like what you do." And I said, "Well, I better. I've been doing it for 35 years. I don't consider this a job. I really consider it just life work."
And yeah, I've never worked a day either.
I can attest to that.
Maybe just the outro?
Yes.
A what?
The one.
An outro?
So
An outro.
The
What
real-
the heck is an outro? I know what it is, but where did that word come from? Listen, Sonja, it is Heart Month, and we want you to take care of your heart. I mean, we work hard all day long taking care of your heart. I want you to kind of ask, how's my heart going? Do I need some help here? And can y'all see that? I want you to put that on your phone. All right?
scan now.
There we go.
So it's Heart Month, and to sign up for heart healthy tips and giveaways, go to our sign up page at baptistmedicalnetwork.com/hearthero.
Well, this was delightful. Thank you for your time.
Well, and thank you for your time. And I will tell you that it has not only been an honor, but an absolute pleasure to be working with you for the
Aw.
last 4 years.
Well, thank you. I concur.
Thank you.
See you on the rebound.
Absolutely.